He pulled up the x-ray on the screen and called my husband and I over there and said, she has scoliosis. And then he pointed at the x-ray and he said, but there's just something else going on. And I feel like from that moment on, our world completely flipped upside down. Adoption has always been on our heart, and so it's something my husband and I always talked about doing. We finalized the adoption process in China and then brought her home. Chloe was almost 2 years old, and when we first met her, we realized she could hardly sit up on her own. She wasn't crawling, she wasn't walking. Just seeing that in itself was scary for us because we didn't know what was going on. Her leg muscle strength was that of a newborn.
Visit with our pediatrician. She said, you know what, go to the University of Iowa. They've got some great people there. Let them check her out. And that's where our journey started.
We met with Dr. Weinstein, specialized in scoliosis, which was something we know we needed to dig a little bit further into.
He said, yes, she's got some scoliosis, but there is something else wrong.
Chloe has been diagnosed with clubfoot congenital scoliosis. She has a neurogenic bladder, spina bifida, and a spinal malformation called diastematomyelia, which is basically a mass that formed on her back. The older she got and the more she grew, the more the mass grew. This type of a mass also has a bone spur that was protruding out of it. And as Chloe was growing, the bone spur was splitting through her spinal cord.
If you imagine like a post growing through a tree, that all those spinal cords went around that fatty mass tumor.
He told us that she, within a week, would need to have a major spinal surgery to try to take out the mass. The surgery was 11 hours long. We didn't know what type of function she was going to have or what type of movement she was going to have. And after about 3 days, she started moving her legs, which was amazing and such a miracle in our eyes. And then from there, it was just a really long recovery. She did physical therapy multiple times a week. Chloe got older and her scoliosis continued to get more severe. She started having a lot of pain. That was really hard for all of us to see. The University of Iowa Hospital has the latest technology on the treatment of scoliosis. Previously, kids that had scoliosis would have rods placed in their back that would need to be replaced every couple of years. For Chloe, she was a perfect candidate for what they call MAGEC rods. And so the way the MAGEC rods work is they go in, they place a rod on the back. She comes in every couple of months and they use a magnetic tool to literally stretch her spine and move those magnets. I remember within 2 days of her having surgery, she was relearning how to walk up and down stairs. Just watching her do that just left us all in amazement. We still have some uncertainties in Chloe's future. Since her initial surgery, she's lost more feeling in her left leg from the knee down. And as she grows older, we really don't know at this time what function she's going to lose. But anything that stands in Chloe's way, she has proven to us time and time again that she can overcome it. There is no doubt that she is where she is today because of the surgeons and doctors and nurses.
Thank you. We appreciate your help. And we appreciate all you've done for Chloe.
Chloe is one of the brightest spots of my life. She motivates me to push past whatever obstacles in front of me and get through it.
She takes pride in being a champion and being brave.
Sometimes it's hard, but I really try to be brave. I feel really happy and proud of myself.
My hope for Chloe as she gets older is to continue to be strong, to be brave, to love and appreciate who she is, because every part of her and every scar and every emotion she's gone through has built her into the strong girl she is today. And I want that to continue as she gets older, to be determined and to never let obstacles, no matter what they are, get in her way.